There are basically three main broad categories in which we can provide anesthesia for a patient. The number one, and what people most commonly think of, is what we call general anesthesia. And general anesthesia is when we have the patient go all the way off to sleep. Other methods that we can also do to do anesthesia, we can do what we call regional anesthesia. This encompasses techniques such as spinals or epidurals that cause a patient to be numb in parts of their body and not feel any parts of the surgery. The third overall broad technique for anesthesia that we can provide is something that we call sedation. This is a technique using a combination of medicines that gets the patient relaxed, comfortable, and sedated, but not all the way asleep, but still able to proceed with the surgery. General anesthesia is the technical term that we use to mean sending the patient off to sleep. This is done first by starting an IV in the pre-op area, and eventually, once we're in the operating room, preparing you to go to sleep. We do this first by putting on appropriate monitors, having you breathe a little bit of oxygen through a mask, and then giving a combination of medications that have you drift off to sleep. These go through your IV, and after that, you are rendered unconscious. For the remainder of the procedure, we are there watching over you, making sure everything is going okay, that your heart's doing okay, that your lungs are doing okay, and that basically the surgery is proceeding well. When you are asleep for general anesthesia, you do stop breathing on your own. So while you're asleep, we typically will place some sort of breathing device. This can be an endotracheal tube or another device called an LMA. These are placed in your mouth, but they are placed after you're asleep and they're gone before you're awake. Most patients never even know that they were there. However, sometimes people do get a sore throat. Potential side effects of general anesthesia include nausea, extended sedation that may continue for several hours, and that's about it. The vast majority of the medicines that we use are metabolized and leave the body within the first 30 or 40 minutes after the surgery is complete. However, there are some slight residual effects that could last for up to hours. So patients may experience some slight sedation for the rest of the day. And for that reason, we tell you that you shouldn't drive or make major decisions for 24 hours. However, again, you should be awake and be able to perform basic tasks pretty much within 30 or 40 minutes after receiving anesthesia. There are potential risks when it comes to the administration of anesthesia, but by and large, we administer it safely and we perform hundreds of anesthetics in any given week. Anesthesia does have potential side effects that can include many of your major organ systems, including your heart, your lungs, and other body systems. That being said, myself and all the anesthesia providers here at Sarah Bush Lincoln have combined decades of training and experience when it comes to the delivery of safe anesthesia.